With the arrival of the pandemic, we had an important increase in the need for mental health services in the English-speaking community. And this was brought to our attention by community organizations that were working with the local populations. It was very evident that there weren't English language health and social services available to meet the needs of this population. So the Community Health and Social Services Network is a nonprofit organization whose mission is to improve access to English language health and social services across the province of Quebec. We've been doing this since the year 2000, and mental health has become a very important part of the work that we do.
We became aware of some of the needs with some research studies that were done. One in particular was in 2020. I demonstrated that the English-speaking population was among the 3 top priority groups being most affected by the pandemic.
We did a survey with men across the province of Quebec, and their level of depression and anxiety was double that of the Francophone population. And they were also having suicide ideation at a much higher rate than the Francophone population. We are able to help 46 different organizations across the province of Quebec improve their capacity to provide mental health promotion and prevention services to the English-speaking populations in their regions. This can come in a variety of different ways. An organization can do workshops, they can do breaking down social isolation activities, they can bring health professionals to events to help people connect to the services that are available. It really depends on the situation of that community and the needs that are being expressed by the population.
In particular, we're targeting within the English-speaking community particular population groups at risk, such as Indigenous communities, LGBTQ communities certainly in the island of Montreal. We're also looking at communities that are regional and sometimes very isolated. Sometimes these communities have additional barriers to receiving services, and in particular mental health promotion supports.
We see this as a really important part of expanding the community that's trying to improve access to mental health services across the province in English, and helping people feel like they're not alone in the work that they do. Language is probably one of the most important aspects of receiving services for mental health. Being able to communicate your very personal and sometimes painful emotional experiences can be very challenging in a second language. And when you start talking about mental health, language becomes almost a #1 priority.